Good evening. Welcome to Journey with Janine. I'm really excited tonight. We have Dr. Robert Ebert with us, who's actually a chiropractor here in town in Waterloo, and he's going to be talking to us about meridian therapy and acupuncture and chiropractics. So welcome, doctor. It's such an excitement to have you on the show and show all these different things that you have here.
Thank you, Janine. Thank you.
First, what I like to do on the show is I first like to talk about your journey a little bit and what kind of got you into this? What drew you into this area? It's not very traditional, at least yet.
Right. At a young age, I had some sports and farm-related injuries, and that got me into a lot of pain problems, and I got a lot of relief and good help from chiropractic at that young age. And then I've just progressed towards things like meridian therapy and acupuncture as I've gone along, and my patient base has gotten older, and I've just wanted to do some more holistic things that were a little more gentle for the patients.
Oh, that's wonderful. Now, how long has chiropractic been around?
110 years in the modern age. It was started in 1895 in Davenport, Iowa by David Palmer. And there's still a Palmer Chiropractic College in Davenport, which I attended.
Now, are there different kinds of chiropractic? I mean, I know there's the Palmer method. Are there different methods?
Well, there's different methods, but it's all for the same purpose.
Right.
And that's to encourage the body to do its own healing by keeping it in better alignment, keep the nerve system free of interference so that healing can go on.
I see. Now, can chiropractic, how does that affect you, like emotionally, physically, the brain? What all does that do to you when you do chiropractic?
Well, we hope certainly for a benefit where it helps the whole body. We know now that the brain is the main storehouse of intelligence for the whole body, so we're going to be trying to help the body keep the impingement or the interference off of the spinal nerve cord from the base of the brain, then the brain itself, all the way through the body, and so that is our hope, that it helps the emotions. It helps just the body have a sense of wellness and comfort.
Well, especially if like they have pain, headaches.
Sure.
And it releases that. I know one time I had my neck adjusted, and it was like I saw auras around everything in the room, and I think it was so much oxygen was getting to my brain.
Could have had a blood rush, yeah.
Yeah, well, which is wonderful. We need that to function properly. So how would you say chiropractic is different than acupuncture? Now, you do acupuncture too, and that's the meridian therapy?
Yes, that's
too?
meridian therapy.
Okay.
It's just different techniques to try to do the same thing, which is help people's with their body function, just be all they can be as far as opening up their body energies, their blood circulation, their nerve supply. Now, the acupuncture primarily involves helping these bioelectrical channels that flow all through the body. And I brought charts. Can I show those?
Oh,
now,
yes,
Jenny?
go right ahead. That's what we want to see. Well, these are like meridians.
Yeah, these are the meridians. And they flow from head to toe, up and down the legs, up and down the arms, up and down the back. And again, these are energy channels that flow with a certain frequency of electromagnetic energy. And where chiropractic primarily is concerned with helping the nerves up and down the back and the extremities, so as that's the way it goes with acupuncture. You want the, where chiropractic is more biomechanical, acupuncture and meridian therapy is more bioelectrical. So you want the electricity of the body, that God-given electricity that we picked up when we started our life in utero, and we want to see that just at its full capacity without any blockage.
I see. Now there's a lot of points on there.
Yeah.
So how many years does it take to, say, if I were going to go into acupuncture, how many years would it take me to learn all of this?
Well, you'd have a good start after about 6 years.
Oh my.
So what we do, we have, my whole career in chiropractic, I've known about these points because I used acupressure.
Okay, yeah.
So I already knew a lot of the points, but I had to tie it in with how the different points would be used with needles or electrical patches.
Right.
So it wasn't a very far reach for me in my mind and education to go along with the acupuncture meridian therapy
now,
and chiropractic.
Acupressure. Now, where did you learn that? I mean, are
Okay.
these different schools that you go to?
Yeah, these
or?
are different schools.
Okay.
This word here, I don't know if it can be seen, kinesiology, is a study of trying to keep all the muscles and nerve balanced. So when we use acupressure, we'll try to use the reflexes too.
Okay.
And this is this chart here. And you do the whatever you have to try to keep the nerve reflexes working with the meridian therapy. So
Right.
you've got several different channels and connections that you use.
So you basically cover all the spectrums or know how to.
Well, I'm studying hard to try to, it's a lifetime learning type
yes,
thing.
I'm sure.
But, you know, as the Lord gives me the knowledge, then I'm going to use it, sure.
That's right.
Sure.
That's wonderful.
And this, I thought I'd mention this. This shows front and back. If you can see this, there's more meridian channels. They're just all over the body.
And you have to know all of those, and you have to learn all of those.
Well, we learn about them, yes. And then we buy mannequins and we buy charts like this, so if we want to know more about it, we have these for reference.
Right, right. That's great. That's great. Okay, okay. For chiropractic and acupuncture, long and short-term effects. Which has a longer effect, or which has it? I mean, can you?
Yeah, we hope they all have long-term effects. I've seen good results, of course, with both. What I was interested in, again, when I went into meridian therapy and acupuncture, is people hurt so much already with some of these conditions, like a shoulder bursitis and sciatica, and some people would wait and wait and wait because they just didn't know if they wanted the biomechanical type. They couldn't stand the thought of somebody kind of pushing on them.
Right.
So, and now I'm blessed to have some patients over 100 now, and I've been seeing them for 30 years. Well, I've seen their x-rays, and I'm not going to be pushing on their bones and their joints because they're just so frail.
Yeah.
So that is a lot of why I went into acupuncture meridian therapy also, is to be able to treat some of these very elderly. And in the very young people now, they're quite, now as soon as they learn it doesn't hurt, then they're open to it. So getting back to the long-term effects, I can't, Janine, honestly tell you which is better.
Yeah.
It's just you've got to use what you think you can do as from the experience that you've gained in the past at any given time to help these people.
Right.
And it's always up to the Lord and His healing power to come through and do the long-term effect. I'm basically His tool here on earth to try to help people with